Patients with femero-popliteal disease can be a real challenge. Oftentimes they have lifestyle-limiting claudication or some chronic ischemia that really is life-threatening. Now, the management of these patients can be a challenge, but perhaps paclitaxel saves the day. I am with Dr. Ehtisham Mahmud, who is professor of medicine and the chief of cardiovascular medicine at the UC San Diego. And in a commentary that you've got coming up in JACC Interventions this month, March, you've got two different papers that you're talking about. First, before we touch on that, how difficult are these patients with femero-popliteal disease?
You know, this has been historically one of the most difficult areas to treat, whether you talk about surgical bypass or balloon angioplasty, bare metal stenting, self-expanding stents for the femero-popliteal segment. And it's been a series of problems that we've had. Restenosis or reblockage is extremely high, stent fracture is an issue, and primary patency, secondary patency, all of those things require tremendous efforts, and despite our best efforts, including using adjunctive atherectomy devices, laser debulking, the restenosis rates have been prohibitively high in the past.
So what approach are they taking in these two slightly different papers in JACC Interventions?
Sure. So the first paper is really treating femero-popliteal disease with just a paclitaxel-eluting balloon. It's native disease, first time, and in those relative intermediate length lesions, they had very good results, and what's novel about this study is that 2-year results have been reported. And previously, with delivery of drugs locally to the vasculature has only been done with drugs coated on stents. And in this study, it's been local delivery of paclitaxel to the vessel wall, and 2-year results are extremely promising with over 80% patency at 2 years. The second study was actually drug-eluting stent, so it's, again, paclitaxel on a self-expanding stent. And in that study, it's a much sicker group of patients, or a much more complex disease, I should say, patients who have already been treated before and now developed in-stent restenosis. And to treat those specific patients, they were treated with a Zilver paclitaxel-eluting stent. And also, the 1-year results were quite good, and at 2 years, about 60% of those patients still had patency. So that doesn't sound that great, but it's a lot better than it has been historically for these particular patients.
I know you write in the commentary, both of these studies demonstrate that a new paradigm for the treatment of FP disease is emerging. So clinically, is this a little more optimistic now for these patients?
Absolutely, I think so, because as opposed to in times past where we had a number of debulking devices, stents, none of which really gave us good results beyond the initial 6 to 9 months. Now we have 2-year outcomes with 2 different approaches, one with a paclitaxel-eluting balloon, another one with a stent, and both have demonstrated actually quite good results in relatively straightforward lesions in one study and much more complex lesions in another study, and both of them should give us some hope and promise that paclitaxel, whether delivered locally with a balloon or coated on a stent, gives us much better outcomes for these patients.
Well, Dr. Mahmud's paper commentary is in the JACC Interventions for March. The 2 papers that he's talking about are in there too. And you can read more about them and a lot of other JACC in a Flash items from CardioSource World News. I'm Executive Editor Rick McGuire.